Welcome to Adapt NCLEX. Do you think you need to memorize everything for the NCLEX? I want you to think about it again. Using these practice questions, I'm going to use them to demonstrate the fact that applying common sense can be your secret weapon to choosing the right answer and being sharp about selecting those answers, especially when you're under pressure. So stick around. I'll show you. You may not even know the content, but all you need to know is a little bit of information and apply your test-taking strategy, reasoning, and be sharp when you select the answers. First question, as you can see, it may be intimidating. It's a prioritization question, but don't worry about it. We are using common sense and being sharp when we select the answers. Test-taking strategy, right? Yeah, I have no clue what is this. What is the next priority? That means they need to do something. You have to be sharp. If you have 1 second, we're going to use 1 second to figure out what we need to do. All the answers are right. A client is on heparin drip for a DVT. Okay, as black clot, you're getting heparin. This is to prevent progression of the clot, right? The APTT comes back critically elevated. Are you going to get scared? Are you going to scream and call the doctor? Is elevated. What is the reason why you're taking care of this patient? Reduction, right? We're supposed to prevent any harm to the patient. Patient is what? On heparin. The major complication in your mind is bleeding. And they call you. They said the lab work is critically elevated. Are you going to stop the infusion and notify the air care provider? Are you going to decrease the rate of the infusion by 50% and recheck it 44 hours later? Do you assess the client for bleeding? Do you prepare to administer vitamin K? Think about it. You see this kind of question when you practice, there's a reason why they're there, to trap you. Common sense. Patient is getting medication. The lab work is critically elevated. What is the first thing when they call you that you're going to do? You stop the infusion and you call the doctor. He's going to ask you, how does the patient look? If you decrease it by 50%, he's not going to address the critically elevated lab work, right? Figure out the event that is already okay. The lab is already elevated. Is it going to affect the patient? Is the patient bleeding now that we got to take extra step to figure it out? Vitamin K has nothing to do with heparin. Don't pick it because you've seen it before. Strategy, test-taking strategy. Assess the patient. See what the patient is doing. Is it dying? Is it bleeding from the nose? Of course, we're going to stop the infusion, but we don't do that right away. In this situation, if there is nothing there, yes, I may hold it because there's a protocol. Heparin is given by protocol if you get an infusion. So probably the lab work they've given you, there may be something the protocol is telling you. This one is critically high. It's the harm that has been created isn't affecting the patient. Just let's figure out. So number 3 is your right answer. We got to assess the patient. As you can see, all the questions would be like that. We're not going to jump and pick an answer choice, but we're going to analyze it in a test-taking strategy way. Which medication should the nurse prepare to administer? That means we should give the patient something. All of them are medication. And nurse assesses the client. That means I've figured out what is wrong with the patient. Patient is what? Unresponsive at home, right? The client respiration are shallow. We have respiratory problem. The pupils are what? Normal, right? And a friend states that the client took a handful of anxiety medication. What medication would you give this patient? Bring your buzzword, put it together, use your test-taking strategy, and be sharp when you select those answers. There is a reason why they told you the patient is unresponsive. Patients are shallow breathing, but the pupils are what? Normal. And a friend said, I took handful of anxiety medication. using common sense and using test taking strategy without being sharp. If you take anxiety medication and you come into the emergency room and you have shallow breath, would I give you another anxiety medication? No. This is an anxiety medication. So that is out. They never told you anything about patient what heart rate, right? All they told you is a respiratory rate. Why do you have to pick atropine? They said the pupils are what? Normal, right? At the same time, the friend said the patient took what? Anxiety medication, naloxone. Don't pick it. It's not used for anxiety medication, and then they whatever is going, if you there's no bipolar change, it cannot be opiate because naloxone is used for opiate. Therefore, this is gone. What are you left with? Flumazenil. Patient took anxiety medication. It doesn't affect the pupil size, but it can affect your respiration. That's why the patient is unresponsive. Attacking the answers using test taking strategy and common sense and being sharp at the same time. Number 4 is the right answer. Same strategy. What do we have? What is the immediate nursing action? That means you have 1 second. What do you want it to do? A client with a spinal cord injury, based on your content, you'll be reviewing for a long time. There's something that should pop out of your mind right now. When you hear spinal cord injury for NCLEX, there's only one thing that should come to your mind. If you're not, then you got to master your content. If you need more, check adapt NCLEX. So I hear spinal cord, there's one thing that should be ringing in my ear, buzzing like a buzzword. Suddenly had a what? Pounding headache, facial flushing, and what? Blood pressure of this. This is all one problem. I hear headache, facial flushing, elevated blood pressure in a patient with the spinal cord injury. I know this is what? Autonomic dysreflexia. If it happens, the problem associated with that, you don't treat it, you prevent further ongoing assault on the patient. Calling the provider is not going to help. There's things you can do with this situation without calling the provider. Laying the client supine is going to worsen because you know the patient is not hypotensive. You see, supine position help with hypotension. Patient is already hypertensive. It's not going to help them. Administer the prescribed antihypertensive. You're treating the problem. Therefore, check the bladder distension, rectal for impaction, constrictive clothing, elevate the head out of the bed. And then if you need any antihypertensive, you give it to them using strategy to answer difficult questions without even knowing. Number 4, and then she's caring for a client with severe septic shock. This is also a key information. Buzzword, underline, septic shock. What priority will you take? Before you look at the answer choice, you tell yourself, septic shock. I don't care about severe. Fine, septic. But the main idea I hear shock, every time you hear shock, there should be one word into your mind. Hypoperfusion. That means no blood flow. So number 1 thing, the first thing you do, improve perfusion. Hypoperfusion, take the hypo there and said normalized perfusion. Which of this is going to normalize perfusion? And that is being sharp. That's number 1 in the common sense way. Collecting blood culture is not going to fix the shock. Vasopressin is never the first thing, right? It's going to even constrict. You need to fill the tank before you squeeze it, right? Antibiotic, I don't even know the infection. So how can I give you antibiotic? And I have to draw culture first before I do that. Test taking strategy, answering the question in the common sense way. I need to fill the tank. Fluid is your friend. Number 4. Number 5, the client with the heart failure gained 3 pounds in 24 hours. Which order should the next question? This is also, I said these kind of questions to show you can answer just by common sense and reasoning, right? You hear all of a sudden you gain 3 pounds. Think about it. If you gain 3 pounds within 24 hours, you feel heavy, you're going to feel uncomfortable. What do you think the nurse should do? Questioning which medication? Furosemide, too much fluid? Whoa, I get rid of the fluid. I'm already fluid overloaded. Why do you want to give me, even if it's 20 ml per hour, it's inappropriate. Oh, I got to check daily weight so that I can figure out you're gaining weight or not. And I got to check your lab work, BMP, because I'm going to give you some medication to help with that. You see? So number 2 is your right answer. You got it, but you got to stay put, pay attention, buzzword, put it together, select the answer, common sense, reasoning, and that is being sharp, right? What is the best intervention? A confused elderly client is found wandering the hallway. All these questions, you can see there's a theme. You can eliminate the wrong answers, and then you left with one sitting there for you. Don't be nice. Pick it. Okay. Don't run away from it because you may not understand it. This is a common example. Patient is confused, is wandering around. What would you do? Self-restraint, less restrictive. I use the word soft, so you think it's less restrictive. No, restraint is not number one. That's why they said best intervention. Reinforce wandering rule. The patient already broke the rule. He's walking around. He's already confused. What are you going to do to reinforce it? It's irrelevant. Offer toileting. Even if you have no idea, it means finding out what is wrong with the patient. If they need to go to the toilet or they need some pain medication, they need something, that's why they're confused, and find something from them. They will talk to you and you can take them to their room. Aripiprazole is going to worsen the situation. You don't give them antipsychotic. You're restricting them using what? Pharmacological restriction. Therefore, 3 is the right answer. And then 6, an LPN helping a client with dysphagia hit lunch. What requires the nurse to intervene? Buzzword, dysphagia. Patient is eating and the LPN is helping. Something should just jump out of your mind. All this is risk reduction, best care, and comfort questions. What do you think? A, patient he has dysphagia and I'm helping the patient feed. That means we want to prevent aspiration. Pick an answer choice that is going to prevent aspiration. The client is sitting upright at 90 degrees. Good. LPN encourage the client to swallow immediately after each bite. It's going to choke. Give them time to swallow. The tray has thickened liquid and mashed potato. Yeah, that one is better for patient who has dysphagia to prevent aspiration. LPN check for mouth clearing before offering more. What do you think? This is opposite to 2. So if you see these kind of questions, why something is not right. 2 is saying swallow quickly after each bite and keep on encouraging. Then 4 said, I got to check their mouth first before. Something is telling you one of them is the right answer and 2 is the bad one. We should intervene. And as here, a high pressure alarm sounding on the client chest tube drainage system. Which action should the nurse take first? This is good one to illustrate what the point of the video. High pressure alarm. Bring your content. If you have no idea, you don't know what it is. Whenever there is high pressure alarm, one thing should come to your mind. There is a blockage or there is a kink somewhere. That's all. Which action should you take? Relieve the blockage. Lower the drainage system below the chest level. That does not help with what? Blockage. It does with drainage, right? That's the normal way. But the question never said the chest tube was up or not. It's not the best way to know that there's a blockage, right? Encourage the client to take deep breath. Of course, this may clear secretion in there, but that is not what the major source of blockage. Most of the blockage is within the chest tube itself, unless the patient is biting the tube. ET tube. This is a chest tube. Assess the tubing for kinking and occlusion. You get the point. Notify the air care provider immediately. Of course. Can you do something before you call the doctor? Yes. So I will do number 3 before calling the doctor, right? And number 9, the client receiving IV potassium complaint of burning at the site. What should the nurse do first? Think about it. I'm giving you medication and there's a burning there, and you are the nurse. You can do so many things before calling the doctor. So common sense wise, you should not pick that answer choice, right? You stop the medication right away, right? But you don't know, you've not addressed the problem that the patient is complaining about. Of course, there's some situation, if it's causing harm, you stop the medication. But look at it, it's complaining about burning at the site of the IV. It may not be due to the fluid that is going through the potassium itself. It may be just the IV is infiltrated. So slow the infusion rate down does not address both situations. You're still getting the potassium. You still don't know what is going on with the IV. Check the IV site for infiltration. Yeah, if there is infiltration, yes, then you can know, okay, that's why it's burning. But stopping the IV immediately is not going to help the situation. You still have no clue. Check the IV side for what? Infiltration. And when you see that, then you stop it. It's complaining. It's not having any bigger side effect associated with the potassium. Verify the potassium concentration is not going to help. So the client is complaining of burning at the site. If I'm the nurse, I just go, you can't just walk in and stop the infusion. You look at it, you got to make an assessment. And that's what number 3 is doing. A client with pneumonia is coughing up thick yellow-green sputum. What action should the nurse take first? Buzzword, I know you have pneumonia. If you have pneumonia, you're going to cough yellow sputum. What would you do? Teach the patient purslipping. Trap. Purslipping is to help with breathing. We use it for emphysema, for air trapping. They said what? Thick yellow sputum. Purslipping does not relieve secretion. It's a trap. It's half cough. You see, content, but at the same time, reasoning. It's talking about sputum, and now I'm doing purslipping. Look at the second one. Another trap. Oxygen. It does not address what? The yellow thick sputum. There was nothing in the question telling you patient is having what? Saturation is going down. Cough suppression is going to worsen it because I already have thick secretion. I should be able to clear it. By elimination, number 4 has to be the answer. Whether I like it or not, I got to pick it. Drinking will improve thinning of the secretion and help you clear it out. This is our Dr. class. Thank you for watching. Happy next week. I hope you're studying good. And then good luck in your exams. If you need help, you can join our crash course that is coming up. Good luck. You can subscribe to our Dr. class for free videos. Best of luck and happiness this week. Take care. Bye.